Alrighty, so one thing that I would like to talk about today is the concept of rib cramping, okay? This is something that I hear about quite frequently in the forums and a question that I get asked very often by patients. Now, to be clear, the ribs are bones, so the ribs themselves are not going to cramp, okay? But in between the ribs, we have muscles called intercostals. Inter meaning in between, costals referring to the ribs. Under normal circumstances, the ribs are typically at about a 45-degree angle. Now, when you have an obstructive disease like COPD, emphysema, chronic bronchitis, asthma, particularly when there's hyperinflation of the lungs, the ribs will actually spread out quite a bit, and the ribs will actually become much more horizontal, and what happens to the intercostal muscles is they become stretched out, okay? So if you recall, recently I was telling you that a muscle works best in its middle range. So using the biceps as an example, being all the way stretched out is not going to be very effective. And being all the way crunched in or contracted is also not going to put the bicep at a good mechanical advantage. And it's the same thing for the ribs and the intercostal muscles, okay? So if you think about the patient with obstructive disease who has hyperinflated lungs and therefore their intercostals are stretched to their limit, think of that as the person who spends all their time with the bicep stretched maximally with the arm straight, okay? For patients who have restrictive diseases like pulmonary fibrosis or kyphosis or kyphoscoliosis, etc., 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 that patient's ribs are going to be much closer together, and as a result, the intercostal muscles are going to be very, very tight. So think of that person who spends all their time with their bicep completely contracted. Now, I've told you several times that the way that muscles get nutrition and remove waste products is by relaxing and contracting respectively. So in other words, a muscle contracts, and that contraction causes blood to be squeezed out of it. And with the blood go the waste products from metabolism. When the muscle relaxes again, the muscle fills with blood that is rich in oxygen and nutrients. So under normal circumstances, when a muscle contracts and relaxes in response to everyday activity, this is an ongoing process that is happening all the time. However, there are certain circumstances, and that can be related to posture, that can be related to musculoskeletal changes related to disease, okay? In which case, the muscle does not get full contraction or the muscle does not get full relaxation. So as I mentioned before, a muscle does best in its middle range. So for the patients that are hyperinflated, where those intercostal muscles are stretched out, they may feel some discomfort related to that stretching. And for the patients that have restrictive disease like pulmonary fibrosis, where the ribs are very close together because of hypoinflation or low volumes in the lung, those muscles are going to be contracted or shortened most of the time, okay? Think about a time when you may have been required to keep your arm or your leg in the same position for a long period of time. Maybe it was a flight, maybe it was a long car ride, but after a certain amount of time, your muscle gets cold, your muscle may fall asleep, you may get numb, you may get stiff. Imagine that's the situation 24 hours, 7 days a week, 365 days a year in response to your respiratory disease. It can also occur in response to your posture. Human beings tend to be creatures of habit, and we tend to gravitate towards the same positions of comfort, okay? As human beings, we will generally lean forward more. We will generally hunch and round our shoulders forward more, all of which prevents you from taking a deep breath and filling your lungs completely. Add to that the amount of time that we spend on computers, watching TV, etc., 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 and it doesn't make for a situation in which we have good muscular balance. It leads to tightness, in the muscles that we lean towards, and it leads to looseness, but also looseness equals weakness in the muscles that we lean against. So in that forward hunched shoulder position, the muscles of the chest will get tight. The muscles of the abdominals will get tight, not in a good way. Whereas the muscles of the back will get loose and weak, okay? So it's important for you to pay attention to this at various times throughout the day. And if you feel like you've been in the same position for a long period of time, get up and stretch out. Another problem that people with respiratory disease have is a lot of pain and discomfort in what we call the accessory muscles of breathing. The muscles of the neck, the muscles of the upper chest, the muscles of the shoulders, the trapezius, the muscles of the upper back. And the reason for that is because those muscles work extra hard in response to the diaphragm not functioning at its maximum. So these are called accessory muscles of breathing, particularly accessory muscles of inspiration, because when the diaphragm is not functioning effectively, these muscles will help to elevate the rib cage and allow you to take a deeper breath. The problem with that overuse is that they get tight and they get short. And as I told you before, a muscle that is tight and short will not be prone to getting good nutrition. It's going to be contracted. It's not going to receive healthy, nutrient-rich blood, and it's not going to flush those metabolites out. So what I'd like to do today is I'd like to show you some exercises that focus particularly on the muscles that often get tight and show you what you can do about it to help relieve some of that tightness for the short term and relieve a lot of that pain for the long term.